Please let me know. Please reach out. There's a link down below if you'd like to work with me. If you're outside Massachusetts, I do life coaching with regards to goal setting and habit formation. So either way, let me know if you want to chat. So today we are going to talk about some great questions that you sent in. And if you're watching this later and you still have questions, you can leave your questions in the comment down below and I'll add them to the next time. So let's get started. Okay, first one is, what do you think about people who say these drugs are cheating? Okay, I mean, I don't know what cheating means. I think they're really helpful. I'm assuming that you are talking about the GLP-1 agonists, and yeah, they're super helpful. I don't think it's cheating any more than like treating diabetes is cheating. I mean, everything we do, you know, there's many different ways to address medical problems. So, and with weight issues, you know, there's lifestyle changes, there's medication, and there's surgery. And those are the three options. So I think we use all available tools that we have for patients with regards to whatever is appropriate for them. And I don't think anything's cheating. I don't really love that term though. I feel like it's a little, maybe not I just don't love it as a term. Okay. So I'm hesitant to go on of any of these medications because of the side effects. Do I hear that a lot? Yes, I definitely hear that a lot because people are scared about the side effects and they don't want to be on it forever. So if you are scared about the side effects, definitely have a talk with your physician about it. I think, you know, we never know until we try. I definitely have some people who just breeze right through it. They have no side effects. They just have really good luck and tolerate the medications really well. And then I have some patients that have side effects with a lot of different medications, or because of their medical issues, they're really limited to what they can be on. So I think you'll never know until you try, but certainly if your weight is an issue for you, it's definitely worth a conversation with your physician in terms of what your options would be. But like I said before, these are great tools to have, and we didn't have them before. So we're so lucky now that we live in this era of when the medications are available, of so many different options that we didn't have previously. What happens if you don't, okay, so if you don't have a problem with overeating, what happens? I'm guessing this is regards to like if you have a weight problem, but it's not really an overeating problem. Yeah, I mean, I think especially for the GLP-1 agonists, they're working on different areas of the, digestion cycle, essentially. So they're working on your stomach, they're working on the brain, they're working on different areas of the brain. So I think I wouldn't not take it if you don't have an overeating problem, because I definitely 100% have patients who are like, yeah, I'm eating how I want to eat and the weight just isn't coming off. There are definitely people that happens to. They're eating how they want to eat. And I think those patients are actually excellent candidates for the weight medications because they've really maxed out on what they can do in terms of lifestyle, especially with their eating. So those are really good patients to try a medication on if they want to, if they fit the criteria. But so it's going to work on your satiety, but it's also going to work on the energy regulation balance and your hypothalamus. So your energy expenditure goes up, your energy storage goes down. So you'll still get an effect even if most people, I can't say everybody, but you are likely to get an effect even if you don't have an issue with overeating. Okay. So what are the downsides of non-diabetic people using the GLP-1s? You do not have to have diabetes to use these medications because they are FDA approved for weight. So not a problem. They will still work for you if you are an appropriate candidate. And I think actually probably a little bit more I'm less worried about somebody being hypoglycemic because I know if they're on this medication, they're probably not on other agents that are going to make them hypoglycemic, and their pancreas is functioning better than somebody who doesn't have diabetes. So I think actually is a little bit, in some ways, there are less things to worry about for people who don't have diabetes. I also don't have to worry about patients having, diabetic retinopathy. That certainly can be something you want to be careful of, or you want to make sure somebody's getting their eye care very regularly if they're starting on this medication. And like if they have had issues with retinopathy, you definitely want to talk to their eye doctor, their ophthalmologist prior to starting one. Make sure you guys are on the same page. But yeah, you do not have to have diabetes, and they work great. I lost nothing on Mounjaro. I just had the side effects. Yeah, sometimes that happens for people. I think it happens less for Mounjaro. I have more people who have lower side effects and they'll lose more weight on Mounjaro, but it's a bell curve, right? So some people are going to lose a lot of weight, more than we expect. Some people are going to lose less weight or no weight or gain weight. And then the vast majority are people in the middle who are going to lose around average 20% total body weight, which is incredible. But we don't know if those people right in the middle, if they're also going to have nasty side effects. So that's a big part of it too. Sounds like for this person that Mounjaro was not a good fit for you, so definitely try other things, non-GLP-1 agonists, or try Saxenda or Wegovy, those types of things. If just broadly education-wise, if someone tried Mounjaro and it didn't work for them, I wouldn't rule out all the other GLP-1 agonists either. Okay. I'm gonna depersonalize this one a little. Okay, so if someone has been on Mounjaro for a couple weeks, is it normal to lose no weight? And I would say yes, that definitely sometimes happens. My goal is to always titrate all the way up for people to get the full effect of the medication. For some patients, I've had some patients that they lose a lot of weight on the lower doses, and so I don't want to go up to the highest doses because that's kind of over-treating, or they just don't need it. But I definitely wouldn't rule it out if if someone has been on the medication for a couple weeks and they haven't seen an effect yet. I think you just give it more time. I mean, certainly there are treatment parameters. So if somebody, let's say they have been on the highest dose of Mounjaro for 12 weeks and they hadn't lost any weight, that is a patient that I would probably think about changing to a different medication because they're clearly not getting an effect. So why bother? Okay. How long does it take to become effective? Okay, very similar question. It really depends. Some people lose weight right away. Some people it takes all the way up to, I've had patients that not great, then they get to that top dose and it really kind of kicks in for them. So I usually try to titrate all the way up and then stay on that dose for at least a couple months if they're not having significant side effects, until I will say, okay, this is not a great fit for this person. Okay. Next question. I've been on Wegovy since last summer and it has stopped working for me. My appetite is back. Okay, so I would say, well, a couple things really importantly to think about. If you feel like the medication is not working for you, the first thing you want to make sure is that you are actually getting the correct medication. So if somebody tells me the medication is not working, like a new patient comes in and they say, I'm trying it and it hasn't worked, I have to make sure they're not getting like a compounded medication or some sort of imported from somewhere else that's not like regulated. It's unfortunate, but this happens a lot because there's such high demand. And so if somebody's getting like a counterfeit version, it very well may not work for them. But so you want to be certain that what you're using is the FDA approved version from a pharmacy. So if you're doing that, the next thing I would think about is what are you eating, and really make sure that you're eating how you want to eat. Because if somebody, these medications work really well, but also, you want to make sure that you're optimizing the lifestyle elements of it too. And certainly if patients are continuing to eat a lot of ultra processed foods, that could be, you know, I would say normally, oftentimes patients get, it's easier to change how they're eating when they see the medications working. But certainly, our bodies respond, a little differently to ultra processed foods. We haven't evolved to adapt to that kind of food. So when we have it throws us off a little bit, and we end up eating more calorically. It takes more of that food to trigger those satiety mechanisms. And it's just, overall, I'm just not a big fan for patients. So just make sure you're cutting out all the ultra processed foods. And what else was I going to say? Appetite is back. Yeah. Oh, another really important thing to make sure is that since you started it, you haven't started any other medication as well, because, and I've made a bunch of videos on my YouTube channel about this, there are a lot of medications that are going to interfere with your weight loss, and they can also interfere with medications that are helping you lose weight, so they're fighting them. So definitely go through your list of medications, see if anything's changed. And I would go over that with your physician as well. If there is something new that you're on, I would have a conversation about, do you really need to be on that? Or is there an alternative that is less weight promoting? Okay, so that's going to do it for today. Thank you so much for watching. If you have questions, if you're watching this later, please feel free to add questions afterwards, and I will add them on to next time. And yeah, thank you so much for watching. Bye.